Hello viewers, welcome back to our channel. Today we'll be doing an in-depth guide on the treatment options for hepatitis A through E hepatitis, which means inflammation of the liver can be caused by 5 main viruses A, B, C, D, and E. Each type has different modes of transmission, severity, and, most importantly, treatment strategies. Let's break them down one by one. Hepatitis A is usually a short-term infection spread through the fecal-oral route, commonly through contaminated food or water. The good news? It almost always goes away on its own. There's no antiviral treatment needed. Instead, we focus on supportive care, getting enough rest, staying well hydrated, and eating properly. Most people recover within a few weeks or months without lasting liver damage. But prevention is key, especially in areas with poor sanitation. A highly effective vaccine for hepatitis A is available and recommended for travelers, children in certain countries, and those at higher risk. Hepatitis B is more serious. It can be acute or chronic and is spread through contact with infected blood or bodily fluids, including through birth, sex, or sharing needles. Acute infections usually clear up on their own, and treatment is supportive. But for chronic hepatitis B, which affects over 250 million people globally, we need long-term antiviral therapy. The 2 main medications are tenofovir or entecavir. These drugs don't cure HBV, but they suppress the virus, reduce liver inflammation, and prevent progression to cirrhosis or liver cancer. In select patients, pegylated interferon alpha may be used, though it's less common due to side effects. And yes, there's also an effective vaccine for hepatitis B, part of the routine childhood immunization schedule in many countries. Hepatitis C used to be one of the most difficult liver diseases to treat. But now, thanks to medical breakthroughs, it's often curable. Hepatitis C is almost always chronic and spread primarily through blood-to-blood contact, such as unsafe injections or transfusions before 1992. The game changers here are direct-acting antivirals, or DAAs. These oral medications, such as sofosbuvir, velpatasvir, or glycoprevir, are taken for just 8 to 12 weeks. And in over 95% of cases, they lead to a sustained virologic response, which essentially means a cure. Side effects are minimal, and these treatments are now the global standard. Early treatment prevents complications like cirrhosis and liver cancer. Hepatitis D is unique. It cannot exist on its own. It needs hepatitis B to survive. That's why hepatitis D is only found in people already infected with HBV. Unfortunately, it causes a more aggressive form of liver disease. Treatment is limited. The main option is pegylated interferon alpha, taken for 12 months. But response rates are modest, and the drug can have tough side effects. A new medication called bulevirtide has been approved in parts of Europe and is showing promise, but access remains limited in many regions. For now, the best prevention is stopping HBV, again, with vaccination. Hepatitis E is a waterborne infection, most common in parts of Asia, Africa, and the Middle East. It's usually acute and self-limiting, but it can become dangerous, especially in pregnant women, where it may cause severe liver failure. Treatment is usually supportive, hydration, rest, and proper nutrition. However, in chronic cases, seen in some immunocompromised individuals, ribavirin, an antiviral drug, may be used off-label. There is an HEV vaccine approved in China, but it's not yet widely available elsewhere. Special attention is needed for pregnant women, especially with hepatitis E, people with HIV who may have co-infections, immunosuppressed patients at higher risk of chronic hepatitis B, C, or E. Treatment in these populations is complex and must be individualized. Regular liver function monitoring and viral load testing are essential for long-term care. While treatment options have dramatically improved, prevention is still our best tool. That means a vaccination for hepatitis A and B, avoiding risky behaviors like needle sharing, practicing safe sex, ensuring access to clean water and proper sanitation. Looking ahead, researchers are working on a universal hepatitis C vaccines, better treatments for hepatitis D and E, curative therapies for chronic hepatitis B, With global initiatives like the WHO's goal to eliminate viral hepatitis as a public health threat by 2030, we're entering a new era of liver health. Hepatitis isn't one disease, it's 5 different challenges. But thanks to modern medicine, we now have the tools to treat, control, and even cure many forms of it. Stay informed, get vaccinated, and spread the word about hepatitis awareness. Thanks for watching. Don't forget to like and subscribe for more medical insights.